Hi everyone, so this is my presentation that I'm going to show my ninth grade physical education class about tobacco usage. I think this is a pretty relevant topic to talk about during a PE class because, tobacco smoke and that affects the body and the lungs and in turn affects with, athletics and physical activity and stuff like that. So it just covers the body. So I think it's a pretty relevant topic to talk about during a PE class. So I get into some statistics for my first slide. And so if cigarette smoking continues at the current rate among youth in this country, 5.6 million of today's Americans younger than 18 will die early from smoking-related illness. Nearly 9 out of 10 cigarette smokers first try cigarette smoking by age 18, and 98% first try smoking by the age of 26. The number of middle school and high school students using e-cigarettes rose from 2.1 million in 2017 to 3.6 million in 2018, and that's a dramatic increase. And that just goes to show that even though cigarettes, cigars, chewing tobacco, and hookah, those rates are going down, the e-cigarettes is dramatically rising, and they're also getting a younger audience. Younger children and adolescents are smoking them, and they're not seeing it as bad as cigarettes, and they're not seeing how those can, like an e-cigarette that's flavored like bubblegum or whatever it is, can affect you the same way as a cigarette could. And the nearly 1 out of every 5 high school students, that's 20.8%, reported in 2018 that they use electronic cigarettes in the past 30 days. In 2011, only 1.5% got, reported the same thing in past smoking an electronic cigarette in the past 30 days. So that's a huge increase in just, 7 years? And about 27 of every 100 high school students report current use of a tobacco product, and that males tend to slightly smoke more than women do, but it's only by a couple percent. It's like 29% and for males, and like 25-ish% for females. So then this I'm talking about, what happens when, since the first inhalation of smoke. So go within the first 10 seconds, nicotine passes into the blood. It acts on brain cells immediately by crossing the protective barrier that's in your brain. Then 30 minutes after a cigarette, your brain undergoes nicotine deprivation, and the brain adapts to accommodate that nicotine. The brain adapts to accommodate nicotine by creating more nicotinic receptors. The more receptors means you crave more nicotine, and so the smoker feels less normal with nicotine flooding receptors and abnormal without it. So that's where the addiction kicks in. And then once you have that addiction, you'll get withdrawal symptoms pretty heavily as soon as that addiction kicks in. So this is what happens physically when one smokes is, the airway, the lungs are immediately constricted, decreased lung function hindering physical activity. You have nagging coughs, and shortness of breath is pretty common. Increased heart rate is going to happen, elevated blood pressure. Carbon monoxide in blood will deprive your body's cells from oxygen. And then hazardous chemicals carried in blood expose carcinogens to body tissues. And just really wherever smoke touches any of the cells, it will harm them. It doesn't do any good. And so what does alcohol affect in the body? So it'll affect the brain, because nicotine causes the release of the chemical in the brain that makes tobacco users crave tobacco, like we talked before. The heart, as a result of atherosclerosis, I'm having a hard time saying that word, but pretty much the heart must work harder to pump the blood. Like I said before, with the raised blood pressure and the increased heart rate, this extra stress on the heart can lead to high blood pressure, heart attack, and stroke. Lungs. Smoking blocks the airways, impairs the lungs, and increases the risk of lung cancer and other respiratory diseases. In the skin, smoking ages and wrinkles the skin. Your fingers can turn yellow, like a yellow tinge to them, because they won't be healthy. And then tobacco also causes bad breath stains on teeth and decreases the senses of taste and smell. It can also cause gum disease, mouth disease, throat disease, gum disease, mouth, throat, and esophageal cancer. And then in your stomach, colon, and bladder, tobacco can cause stomach ulcers and bladder, kidney, and stomach cancers. So not that great of things can happen from smoking. So this is just the diseases that are attributed to smokers, and what long-time smokers tend to get more often than non-smokers. So cancer, which is a disease of abnormal cells growing and spread. They have an increased risk of cancers in the mouth, throat, breast, lungs, and pancreas. And smoking is the most common cause of death from cancer by far. And then after that, there's chronic bronchitis. It's a condition where mucus blocks the airway. People with bronchitis must cough to dislodge the mucus. So you have that it's called, you might hear smoker's cough. That's what it is. It's that real loud, deep cough that just won't go away. Respiratory infections such as colds and pneumonia. Smoking robs the body of vitamin C, which helps keep the immune system strong. Emphysema is a condition in which the air sacs in the lungs become damaged. As a result, the body does not get all the oxygen it needs, and is responsible for 100,000 deaths per year. And then asthma, which is, most of you probably know, but smoking does cause this, is a chronic inflammatory disease of the airways. Secondhand smoke exposure causes children who already have asthma to experience more frequent and severe attacks. So after that, I get into my activity, and it's where everybody will grab a straw. On my whistle, they'll run into place as fast as they can to get their heart rate up. After 60 seconds, I'll blow my whistle for them to stop. And then I'll have them plug their nose, put the straw in the mouth, and only breathe through the straw to simulate what it's like living with emphysema. And so then, again, they'll get a better understanding of the seriousness of the disease and how smokers will live with this day to day. And then after that, get them into groups. They'll get a poster board, the markers, the writing utensils that they need. They'll brainstorm research ideas relating to tobacco use and how it affects the mind, body, personal health, day-to-day activities, and or athletics. They can use their phones because it's going to be a non-dress day, so they'll have their phones and backpacks and all that with them. And then I'll give them about 10 minutes to create posters, and then as a group, they're going to go up and present what their group, what the group found and brainstormed and talked about, and try to teach their peers and get broader understanding of tobacco and all the different aspects of life that it affects. So I think it's a pretty good presentation to talk about, especially in physical education class, and especially with the rise of e-cigarettes. It's important to get it out there that e-cigarettes are just as dangerous as all the other cigars, hookahs, tobacco, all that. And so just hopefully they'll take away something important. Hopefully they won't they'll think twice about smoking a cigarette and stuff like that. Think back to this presentation. They'll have a little bit more information to go off of than they knew previously. So, thank you.